This video explains how to use the plasma pen. First, install the handpiece holder. Align the locking tab with the slot, then push it upward into place. The machine includes 4 treatment tips. Tip number 1 helps lift the facial contour and improve the appearance of a double chin. Tip number 2 supports product absorption, stimulates the skin, and improves dullness. Tip number 3 supports collagen elasticity and helps smooth skin texture. Tip number 4 is used for superficial pigmentation. Tips 1, 2, and 3 are used for lifting and firming. They may contact the skin and must be used with a generous layer of conductive gel. Tip number 4 must not touch the skin. Before every treatment, wipe and disinfect the treatment tip with sterile saline. To install a tip, screw it clockwise into the handpiece and tighten it securely. Connect the power cord at the back of the main unit. Press and hold the power button for 3 seconds to turn the machine on or off. This button starts or pauses treatment. Use the plus and minus buttons to adjust the energy level. The maximum setting is level 9. After you press start, the display shows a 10-minute treatment timer, and the indicator light turns on. For lifting with tips 1, 2, and 3, begin at energy level 1 to 3. Increase the level gradually according to the client comfort. For tip number 4, begin at energy level 1 or 2 and work in 1 or 2 brief passes. Keep the tip away from the skin and never stay over one spot for more than 2 seconds. Important, always press pause before changing a treatment tip. Now the setup instructions are shown again. Install the handpiece holder by aligning its locking tab with the slot, then push it upward into place. Four treatment tips are included. Tip 1 lifts the facial contour and improves the appearance of a double chin. Tip 2 supports product absorption, stimulates the skin, and improves dullness. Tip 3 supports collagen elasticity and smooth skin texture. Tip 4 is used for superficial pigmentation. Tips 1, 2, and 3 may contact the skin and should be used with conductive gel. Tip 4 must not touch the skin. Before treatment, disinfect each tip with sterile saline. Screw the selected tip clockwise into the handpiece and tighten it securely. Connect the power cord at the back. Press and hold the power button for 3 seconds to switch the machine on or off. Use the start and pause button to control treatment. Adjust the energy with the plus and minus buttons, up to level 9. When treatment starts, the 10-minute timer and indicator light will turn on. For tips 1, 2, and 3, begin at level 1 to 3 and increase gradually according to the client comfort. For tip 4, begin at level 1 or 2. Keep it away from the skin and do not remain over one spot for more than 2 seconds. Always press pause before changing a treatment tip. During operation, hold the insulated part of the handpiece. Do not touch the metal section of the treatment tip. Next, we will demonstrate the treatment procedure. Start with tip number 1. Apply a generous layer of conductive gel, beginning at the neck. Move upward from the neck toward the face using lifting strokes. Ask the client about comfort. If there is very little sensation, increase the energy to level 2. Work upward from the corner of the mouth with smooth lifting movements. Press pause, then change to tip number 2. It can be used from the neck up to the forehead and across the cheeks. Apply more conductive gel whenever needed. Pass tip number 1 over the area about twice, then repeat with tip number 2. Tip number 2 may also be used over the full face. After finishing this side of the face, pause the machine and change to tip number 3. For neck lines, move tip number 3 upward, and also work horizontally across the lines. On the face, use the same controlled movements around the mouth and other areas that need treatment. For fine lines near the outer eye, move gently upward and downward, then lift upward. Keep a safe distance from the eye itself. On forehead lines, move vertically and horizontally with continuous, controlled strokes. The combined treatment time for tips 1, 2, and 3 is approximately 10 to 20 minutes for the full face, from the neck to the forehead. Now we will demonstrate tip number 4 for superficial pigmentation. Begin at energy level 1 or 2. Keep the treatment tip slightly above the skin without making contact. Depending on the size of the spot, apply 1 to 3 brief pulses. Never stay over one area for more than 2 seconds. Apply a very short pulse, then move away. Each pulse must last less than 2 seconds. Stop when the surface of the treated spot turns white. Do not continue treating that spot. The treated surface turning white is the endpoint. The same technique is shown on another spot. After treatment, apply an appropriate skin repair product and follow the product instructions. Keep the treated area dry, especially during the first 24 hours. When cleaning the face the next day, use a cotton swab around the area and do not touch the treated spot. This concludes the demonstration. Please consult the instruction manual for complete guidance and safety information.